American health officials thought you could only catch this virus if you came within 2 meters of an infected person for 15 minutes straight. But a study released by the U.S. Centers for Disease Control found that's not the case.
An individual who had a series of shorter contacts, but over time added up to more than 15 minutes, became infected.
That individual was a 20-year-old prison guard. During an 8-hour shift, he wore a cloth mask. Surveillance tapes show he had short but repeated encounters with 6 asymptomatic inmates for a total of 17 minutes. While they were in their cells, inmates weren't required to wear masks. A week later, all 7 men had COVID-19. The U.S. has now changed its definition of close contact to 15 minutes of exposure, even if it's broken up. In Canada, there is no 15-minute rule, but doctors argue public health officials here should update their guidance on airborne transmission of this virus and remind Canadians that people are most infectious before they show symptoms.
I think there's a larger blind spot that I hope that public health officials in Canada will be digging into.
That includes outbreaks in gyms, restaurants, and schools, environments where tiny infectious particles may linger in the air, especially when there's poor ventilation.
We've just said the best thing to do is to stick to that 2-meter buffer.
Federal health officials say our advice remains the same. Limit time spent in closed places, crowded places, and close contact situations. Which is why Savannah Downs feels there should be fewer kids in classrooms.
I did not feel confident sending him back to school with the information that we were given.
Be it a school or a prison, when you don't know who's sick, less close contact is best. Christine Burak, CBC News, Toronto.